This is the fourth meeting we organize.
The fourth Belgrade Balance Forum proved that interesting topics and lecturers brings experts from this narrow field to Belgrade, not only from all over the Balkan region, but from other parts of the world as well.
And for me, it's not hard task to organize it each year, because in this field of medicine we have so new things emerging.
There is also the atypical picture of Meniere's. People can present with cochlear symptoms only or vestibular symptoms only.
Differentiating patients with Meniere's and vestibular migraine is not easy. But Professor Hamid from Cleveland and Dr. von Breven from Berlin helped to resolve this ever-interesting connection between these two disorders with similar presentations.
They can present quite similarly. They are almost twins. The most important diagnostic test is an audiogram to separate it from Meniere's disease, because that shows then unilateral hearing loss on one side, and otherwise it's mainly the history and the physical examination that makes the diagnosis.
With the dexamethasone, the steroids, we have the ability to preserve hearing in about 40% of patients, to the point that they don't need to sometimes use hearing aids.
Dr. David Shmulevich presented CANVAS, a recently described syndrome of cerebellar ataxia with bilateral vestibulopathy and peripheral neuropathy.
An objective measure called the video VVOR. So this is, as you say, a terribly simple test where the patient looks at an earth-fixed target and their head is slowly rotated side to side, and we look for the saccadic or broken up movements.
3 workshops enabled participants to get practical experience in treating BPPV, recording VAMPs, and to learn various kinds of oculomotor disturbances in centrovestibular disorders.
I was very pleasantly surprised with the lectures and everything I learned. I got lots of new and useful information, so I'm very impressed actually.
It was very informative, and everybody was very approachable, and they answered a lot of questions.